How's it going, guys? Past level question for MSK Anatomy Step 1, I am FM2CK. Before we start, please subscribe to my channel. I really appreciate it. Give you a like, really appreciate it. Find me on Instagram, Mehlmanmedical, MEHLMan_medical. Links down below for me. Telegram, links to the Telegram group and channel down below. Let's start the clip. 31-year-old man, 5-month history, stiffness, pain, lower back, symptoms worse in the morning, improved throughout the day. No radiation of the pain down the buttocks or legs. He also reports stiffness of the lower back following sitting for prolonged periods of time. Physical exam shows that the patient is unable to bend forward completely. Question wants to know which is most likely to confirm the diagnosis. Past level question, as I said, let's just hop to the answers here. Choice A, antibody titers, wrong fucking answer. So this condition, as I'll talk about obviously as we move through, doesn't relate to antibodies that you would order, okay? Other high-yield conditions, obviously, rheumatoid arthritis, it's going to be a woman 20s to 30s, symmetric bilateral joint involvement. You would order anti-rheumatoid factor, okay, or I should just say rheumatoid factor, which is going to be an IgM antibody against the Fc region of IgG. You'd also order antibody titers for anti-CCP, anti-cyclic citrulline peptide. The latter actually more specific for rheumatoid arthritis than rheumatoid factor is. Point is, wrong fucking answer. Choice B, DEXA scan, nonsense answer. Choice, wrong fucking answer. Okay, so bone densitometry can order after age 65 for females looking for decreased bone density, okay, of the hip and spine. Now, in terms of the frequency, that can vary between patients, but USMLE, just simply for FM, they just want you to know you don't do this before 65. That's it, okay? You'll get females who are in their 50s, for instance, and they'll throw that in there as a distractor. A student might occasionally choose it, not before the age of 65. Not dramatic, wrong fucking answer. Choice C, HLA analysis, wrong fucking answer. Now, obviously, some students will have chosen HLA B27 thinking that, okay, well, diagnosis is clearly ankylosing spondylitis, male 20s to 40s with lower back pain that's worse in the morning, improves throughout the day. Okay, you say, well, I don't get it. How is HLA B27 wrong? Okay, well, although this is seen classically with sacroiliitis, ankylosing spondylitis being the more severe form of that, it's not confirmatory. Okay, so this can be done as part of the workup, but it doesn't confirm the diagnosis. USMLE really likes that. They want you to know HLAs don't confirm diagnoses. But HLA B27, although likely to be positive in this patient, refers to PAIR, PAIR, psoriasis, ankylosing spondylitis, inflammatory bowel disease, reactive arthritis, formerly known as Reiter syndrome. So if this same patient, let's say, had blood in the stool, we'd want to think that maybe that's Crohn or UC. If this same patient had eczematoid skin lesions, such as on the extensors, we'd think that that maybe is psoriasis, okay, or arthritis. We could think that could be psoriatic arthritis, or if there's a recent urethritis, we could think that that's reactive arthritis. So you have to think about the pair constellation in relation to HLA B27. But for confirmatory purposes, wrong fucking answer. Choice D, measurement of ESR, wrong fucking answer. This won't confirm anything. Very non-specific, could be increased even if in patients who are completely normal. For USMLE purposes, this could be high in, let's say, an infection, autoimmune diseases, sure, okay, but this is sometimes a distractor answer choice. You could be aware, even for multiple myeloma, it can be high, okay, high ESR with reload formation. Made many clips on that as well. Wrong fucking answer. Choice C, X-rays, correct answer. Now, this is very similar to an NBME question where they have pretty much the same presentation, and the answer is X-rays of the sacroiliac joints. Okay, the NBME question even easier than this one. All right, so the workup involves X-rays for confirmation. Okay, so it could show joint fusion, joint space narrowing. Okay, so it can show erosions, sclerosis. Okay, so different changes of the sacroiliac joints. USMLE wants you to know this is confirmatory. Okay, now this actually shows up on a retired Step 1 NBME. We could say, well, isn't this very 2CK-ish? I agree. Okay, it does sound very 2CK-ish, and of course this would be overlap for Step 1, Step 2, but point of consolidation here is that ankylosing spondylitis is part of an umbrella term of conditions called sacroiliitis, and that's going to be classically a male, 20s to 40s, who has back pain that's worse in the morning, gets better throughout the day. Most severe form of X-ray, which I probably should have mentioned, is bamboo spine. Okay, so in addition to the joint space narrowing, fusion, erosion, sclerosis, bamboo spine, they can sometimes show you an X-ray of that. So very buzzy as well. You know the deal. I'm going to make more content. If you like my stuff, subscribe my channel. Appreciate your time. That's it.